going to look at the kidney stones. So how does the kidney stones look under the microscopy? So this will be our topic. So to begin with some questions, talk about the first one, talk about the cystine stones. The second question we want to ask is, how is the ammonium urate stones? So in this video, we'll find the answers to these questions and we'll learn in detail of the other stones. To begin with, we look at the struvite. The struvite or the staghorn. So how does it look in appearance? Wait, first we'll write this. Staghorn stones. So appearance wise, it looks like rectangular. That is, it looks like as if it is in the coffin. This is how it looks. And the points we need to know, it is radio opaque. It is radio opaque. Next, it is seen in case of the alkaline urine. Then it is rectangular. It is rectangular, as well as it is coffin lid appearance. It has a coffin lid appearance. Then we look at what is it associated with? It is associated with the urea splitting organisms. Next, we move on to the crystalline stones. So how does the crystalline stones look? So the cystine stones, they are nothing but it is radiopaque. So before that, how does the appearance look? So this is how it is hexagonal shape. So this is how the cystine stones look. So these cystine stones, they are nothing but it is radiopaque. The struvite stones, staghorn stones are also radiopaque. So this is also it is radiopaque. And what are the other features? It is seen in case of the acid urine. It is seen in the acidic urine. Then we need to know it is hexagonal shaped. And it is very hard. It is very hard. Then we move on to the uric crystals. So the uric acid crystals. So what are these uric acid crystals? So under uric acid crystals, they are in varying shape. Okay. That is, they can be rhomboids or parallelogram. So they can be in random shapes. Rhomboid, parallelogram, they are in random shapes. And this is the first radiolucent. So it is radiolucent. Then it is seen in case of the acidic urine, and they are in varying shapes. They are in the varying shapes. So this varying shapes, it means that it can be the rhomboids. It can be rhomboids as well as they can be the parallelogram. So next we move on to the calcium oxalate. So what is a calcium oxalate? So in case of calcium oxalate, it is the mono or the dihydrate stones. It is the mono or the dihydrate stones. So here the shape is, it is dumbbell shape. It is dumbbell shaped. So to look at some points, it is radio opaque. It is a radio opaque, and it is also the acidic. It is seen in the acidic urine. Then, as we already discussed, it is the dumbbell shaped. It is dumbbell shaped, as well as it is envelope shape. So it is nothing but the most common type of renal calculi. So it is the most common type of the renal calculi. Lastly, we'll move on to the ammonium urate stones. So under the ammonium urate stones, it doesn't, the shape is, it is almost shapeless. So here it is radiolucent. It is radiolucent, and it is associated with the laxative abuse. And it doesn't have a significant shape. Now to answer our questions, the first question we asked was, what is the characteristics of the cystine stones? So cystine stones, the answer would be, how was the shape? So it was hexagonal. So the shape comes to our mind, it is hexagonal. And then it was also the radio opaque. And it is a very hard stone. It is a very hard stone. So these are the points about the cystine stones. Next, we'll look at the ammonium urate stones. This is the second question, ammonium urate. So under the ammonium urate, it doesn't have a significant shape. It doesn't have a significant shape, and there it is radiolucent. The radiolucent. Then it is also associated with the laxative stones. So it is associated with the laxative abuse.